Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. Alhamdulillahi alladhi hadana li hadha wa ma kunna linahtadiya lawla an hadana Allah. Alhamdulillah, we are blessed again this year to be able to perform one of the most important Islamic rites of Hajj in Medina and Mecca. And this year, we will be starting our journey on 16th June and returning, inshallah, by 7th July. So to start with, after invoking Allah to help us and to give us hidayat, I would like to first send my salutations to Muhammad sallallahu alayhi wa alihi. Allahumma salli ala Muhammad. You are blessed persons to be able to go to Hajj. And once you have done the niyat for going to Hajj, Allah has kept 70,000 angels circulating around you to protect you in every other way. One of the prerequisites of Hajj is to be in good health. And to be in good health is required so that you can perform the Hajj well. So it is imperative and it is necessary that we take care of our health. This first slide shows Masjid Shajara or Dhul Hulayfa, or the Miqat from Medina when we go to Makkah. And this is the third night of Zil Hajj. As you can see, the moon is small. And this is a typical, like a cone shaped mosque with a lot of palm trees. It's going to be extremely hot this year. Next slide. Next slide. So pre-Hajj, we need to know what are the things we require to do pre-Hajj. Number one is you need to consult your physician for any problems you have. Number two, we have to have all our vaccines done. For Tanzania, the requirement for entering Saudi, have meningitis vaccine, hepatitis vaccine, yellow fever, and COVID-19. And pre-Hajj, because this is the time now, you need to have your own first aid kit depending on what are your own requirements. So a little packet of Panadol or a little small plaster or things like that, which are your own first aid kits. In Hajj, as you can see, the requirement is the meningitis vaccine and hepatitis vaccine and yellow fever vaccine and COVID-19 vaccine. So let's go to meningitis here. Meningitis is an infection of the brain and the spinal cord. It's life-threatening and it's associated with very high fever, neck stiffness, which can progress to coma and death within hours. Vaccine is very effective in preventing meningitis. And the strain called ACW137 is the commonest in congested areas and gives a 3 years protection, although the most recent one gives you a lifelong protection. For those who cannot take the vaccine, 1 dose of ciprofloxacin is helpful in killing the germs which stay in the airway. And even after you have taken the vaccine, when you are coming back, it is advisable to take 1 dose of ciprofloxacin to prevent the spread of disease, just in case if the bacteria are in your nose, so that you don't bring it to the family back home. Meningitis vaccine is not recommended in pregnant women. Then we have viral diseases. General viral diseases are associated with, depending on the age group and immune status, depending on how much infection contagion you have got, depending on the incubation period, the associated features of any viral disease are you have flu-like symptoms, swelling of the lymph nodes, tiredness, some rashes, sometimes swelling of the parotid gland, chills and rigors, goosebumps, and sweating. And common examples of viral fever are mumps, measles, rubella, chickenpox, flu, adenovirus, swine flu, herpes simplex, herpes zoster, yellow fever, something called infectious mononucleosis, and even COVID and Middle Eastern respiratory syndrome. In general, you don't need to remember all these names. In general, a viral fever makes you a little tired, feverish, runny nose, some swelling in the lymph nodes. And if you have any of these symptoms, then try to avoid contact with other people and seek attention immediately. Then we have hepatitis A and hepatitis B. The vaccine required for Saudi entrance is hepatitis B. The hepatitis A vaccine, although very much recommended in many countries like India and Pakistan, it's not a very recommended vaccine because it's only effective for 1 or 2 years, and you have to keep on repeating. The most important prevention of hepatitis A is clean water and clean food and hand washing. But hepatitis B can be dangerous. It is a blood-borne disease. It can be transmitted through intimate contact, blood transfusion, and even a single drop of blood in a swimming pool which is not sterilized, no chlorine, can lead to spread to a person who has an open wound or an infection on the skin, which can then go into the body of the person, cause liver damage, and the late signs of this, late symptoms or late manifestations is even cancer of the liver. So hepatitis B is serious and you need to get this vaccine. Just in case there is, God forbid, accident or trauma or exposure to blood in any other way, then it is necessary that this vaccine is there and that will protect us. Yellow fever, we have the virus which exists here, and we also have the vector. It is potentially a serious illness and fatal in a very short period of time. It mimics many diseases. Now, yellow fever is not same as jaundice. Jaundice is a manifestation of a liver disease, which can happen in hepatitis A and hepatitis B and any liver disease. But yellow fever is a viral disease which is spread by a mosquito. It can very high fever, bleeding from the nose, bleeding from the GI tract, joint pains, and very fatal and very fast spreading. It can actually kill very soon. So the only protective, there is no treatment for it. The only thing is to protect yourself from yellow fever. And taking this vaccine is a great idea, even if you are not going to Hajj. There are danger signs. There are danger signs which you need to check. The danger signs are chills, neck stiffness, intense headache, vomiting, confusion, and loss of consciousness. If you have any one of these signs, these are danger signs, irrespective of whatever kind of illness. I would add here, if you have severe pains in the leg, if you have breathlessness on climbing the stairs, don't take it easy. If you have severe pain in your legs, I've not added these bullets, severe pain in your legs and breathlessness on climbing stairs, don't take it easy. Seek attention. During Hajj, watch what you eat. Imam Jafar Sadiq al-Islam said, when you eat fruits and vegetables, make sure you clean them. Make sure they are clean. Drink plenty of water. As we know, kulla hayyin shay'in min al-ma'i. Everything which is living is created from water. And what necessary in such an environment with temperatures rising to 50s. Then you have to be also safe and secure, such as being careful of the fires, fractures, and traffic accidents. In 2017, when there was a scare of the swine flu, and there was so much scare that some people were they were not allowed to attend Hajj And in that year, there was no death in swine flu in Makkah and Medina from the newspapers we were reading. But there were 270 people who died in floods, which happened torrential rain in Jeddah and Makkah. So you need to be careful to be safe from fires, fractures, and traffic accidents. And traffic accidents were the highest cause of death in that year. So be careful, especially in crossing those highways and roads. Like when we cross from Jannat al-Mu'alla, when you are going to the Haram, in that road, sometimes the cars are coming in terrible speed. And some of these drivers are like Jat, and they would just drive recklessly. So be careful of this. Observe cleanliness and hygiene rules. Do not exhaust yourself. Refrain from smoking. During Hajj, keep your medicine safe. Extreme heat or extreme cold can destroy the medicines. For those who are on insulin, we have refrigerators. You can keep your insulin in the fridge and make sure they are kept safely. For those who think they have a runny nose or a cough and cold, then cover your nose and mouth by mask, social distance, and hand washing. Be careful when having a shave. Use sterile needles and sterile blades and reliable people to shave your head. Otherwise, you will end up having other infections into you, including HIV. Smoking is qatil. At-tadkhin qatil. Smoking is dangerous for you and for those who are around you. This is the haram. It has changed a lot. But remember, you are going to be the guest of Allah. And therefore, you need to prepare yourself well, mentally, physically, and spiritually. For physically, a good health will allow you to do your ibadat better. So what are the things which can happen in Hajj? As we said earlier, respiratory infections, flus, colds, and pneumonias, gastroenteritis like diarrhea, skin disease, sunburn, scabies, fungal infections, sunstroke, and heat exhaustion. I'll talk a little bit more about this. It's going to be extremely hot, and we'll talk more about this. But sunstroke and heat exhaustion is the first step towards sunstroke. If you are going into a hot sun, out in the peak of the day, going to the haram or shopping or anywhere out, be careful of heat exhaustion. You may come back and you feel very tired, extremely thirsty. Your urine is very concentrated. You actually feel nausea and you don't feel well. These are early signs of heat stroke. And it can immediately go into sunstroke or heat stroke. When it goes into sunstroke or heat stroke, you become unconscious. Your body temperature goes extremely high. Your brain cannot then control. The temperature goes soaring high and it can damage very vital parts of your brain and tissues. And therefore, it's very dangerous. So be careful of extreme exposure to heat. You can get sprains and strains. We'll come to it. Cracked feet, and then later on, what we call post-Hajj syndrome. So the precautions, as I said, again, avoid close contact with patients if you are unwell. Even if you are well, don't go to a room where there is a patient who is sneezing and coughing and said, "I'm a company You do that if you are already exposed to it. You wear a mask, but don't keep a lot of crowd to come and see, however famous he or she may be, or however close and social somebody may be. Try to avoid visiting patients for too long, for too much of a time. Avoid crowded areas. Make sure you hand wash. You don't drink icy and spicy water. And when I say spicy, means katone, grape juice and passion juice and, those kind of things. Clean and safe food and personal hygiene. Have well-ventilated clothes and drink plenty of fluids. ORS, fluids. In Muhammad Jafar's group, there is all the time oranges supplied. So you can eat oranges, or you can just squeeze orange and dilute it with water. If you cannot drink water alone, you feel water is not tasty and not palatable for some, then make it into a juice and drink it, but diluted one, no sugary, no fizzy drinks. Specific precautions, specifically heat-related diseases happen mostly while performing tawaf at noon or standing in the sun outside in Khule Asman on the day of Arafat, or in Mina in places like slaughter places or walking the long distances to Jamarat. For sprains and strains, an example, the commonest one is the ankle sprain. Raise your feet, immobilize, compress, and elevate. In a short form, rise. So stop moving, press or compress the affected area, keep it cool, and raise the affected limb. Otherwise, you will damage the sprained ankle further. Post-Hajj, there is fatigue, exhaustion, muscle pains, suntan, you become very dark, it's fine. Cold and flu, insomnia. This will disappear in around 6 weeks or 8 weeks. Advice for pre-existing condition. If you are diabetic, make sure your sugar is controlled. Get your HbA1c before you travel. Make sure your foot is as clean as your face. And make sure you don't wear very tight slippers and jumpers and shoes to avoid blisters in your shoes, in your legs. Because sometimes when you walk in dry desert areas with that heat, you may easily get blisters, even if you don't have diabetes. And if diabetic people get blisters in the feet, then it is very risky. In Medina, I would advise you to wear socks because it's dry and you get a lot of cracked feet. Socks, even for men, not only for women for hijab reasons, but even men should wear socks in Medina to avoid the dry, hard, rock-like floors with the heat and the dust. If you are hypertensive, you have high BP, please make sure you take all your medicines. For heart disease, avoid exhaustion, keep a diet low of fat and salts. Perform Hajj rituals with a group or a group of people, 1 or 2 or men groups, so that you have help all around. Take rest immediately when there is any chest pain or dizziness or you feel uneasy. Don't take it easy if you are uneasy. For those who have asthma, take your pumps and your medications. You know that it can be very emotionally overwhelming to be at the Kaaba. And sometimes it can trigger, emotions can trigger asthmatic spells. So be careful, especially while going to Tawaf and during Sa'i, to take your pump or to have taken already before you do that. For those who have arthritis, varicose veins, allergies, and malaria, please take care of this. For malaria now, let's come to malaria. We are from Tanzania and malaria is an holo-endemic. It's there. Many of us have malaria parasites, but it doesn't show. When you get exhausted or tired or immunity goes low, then malaria can actually surface out. Now, if I'm sitting here and talking and I have no other signs, I may still have the parasites. You don't need to treat. But if signs and symptoms happen, if I have fever and body ache and all those signs and symptoms of malaria, which you very well know, abdominal pain, dizziness, then it's good to seek help. Anyone who suspects himself or suspects anybody else for signs and symptoms of malaria, we will be carrying with ourselves the malaria rapid diagnostic kit. But it would be a good idea before you travel from here, 24 to 48 hours, just go and get yourself checked for malaria. So if it is negative and then you get the malaria parasite on the night before you travel, by the time signs and symptoms come, it will be 14 days. And inshallah, by that time, you will have really advanced into the Hajj and even finish and almost coming back. And inshallah, it won't happen anything. But if you suspect malaria, ask for a malaria test. Before you travel, please check for malaria. Okay. For women, they take pills for delaying menstruation because of ahkam of the Hajj. They take contraceptive pills or other tablets for regulating the periods. You have to consult your gynecologist or an experienced physician before taking any of the drugs. And you have to be aware of the side effects. If you are hypertensive and you want to take some medicines, your doctor will advise you. Complete report of your case if you have any issues. And for example, if you are pregnant, then make sure you have told people close to you. Be careful of avoiding immobility of the limbs for a long time. So you have to be a little mobile and up and about. If you sit too long or sleep too long, it can cause clots in your legs and can cause problems. Drink plenty of fluids. If you find any signs and symptoms which are not usual, please consult your physician. Some people say pregnant women should not go for Hajj, but I think that's not right. They should go to Hajj if they are mustati in their own rights. Pregnancy is not something which prevents you from going to Hajj. It's not a disease. It's a normal thing to happen. Problem. What to do if you have a problem? See the doctor if you are not well. Adhere to the doctor's advice. Stick to the announced clinic timings, but you will always be getting a doctor anytime in emergency, especially now that we have WhatsApp and there is a number from which you can utilize. Utilize it only when you are in trouble, not for everything and anything you want to ask. There are clinic timings, adhere to timings. Please observe Islamic dress code and the timings. Usually it's accessible at various gatherings. The doctors are accessible at various gatherings, at breakfast, at lunch, at dinner, for any minor questions or clarifications. If there are emergencies, our volunteers will handle it swiftly. Even if the clinic is closed, you contact the volunteer and you will get help very soon. So don't panic. Do not help yourself with medications from the clinic. You open the door, just take anything. And if you have a bunch of medicines you have come for your own akiba from home, do not share it without that being advised by the doctor. I will stop here, but I tell you, good health ensures good Hajj. And I'll tell you, it's not frightening, it's not dangerous. It's a good thing to happen. It's nice, and we will all be there together to help each other. And Hajj is no exception. Thank you for listening. And now I'm ready for question answers.
Assalamu alaikum. Thank you very much, sir. It's okay. So, just
yes, so we will welcome questions in two ways. Either you can write your question down in the chat box, or you can select the option to raise your hand. So if you have any question, please raise your hand, and we will unmute you so you can ask your question directly. We'll start off straight away with this first question, which we already have on the chat box from Nishad. So it says, Salams, what are your recommendations for autoimmune conditions?
This is a very, very good question. And that is why we will be distributing on the first day of Hajj Missiles a questionnaire which you will write to us all your personal and individual disease conditions, because we can't cover all the conditions, and this kind of conditions will be in that questionnaire. It will really help us to know what to carry in case XYZ has got an autoimmune disease. We as doctors have taken oath of confidentiality, so nobody should fear that. We will have as doctors your forms, and we know somebody has got such and such problem, or is taking such and such drug which may be causing a problem with such and such food or other interactions. So autoimmune disease, depending on the severity and the condition and the level, you will know that your physician has already advised you whether you are on steroids or whether you are on any hydroxyquinine or any other medications which you are taking, and therefore those should be continued. They can be flare-up and they can be exacerbations. And therefore it's important to know this. Therefore, now that I know that there will be a fellow who judge who is potentially having or has autoimmune disease, I will carry 1 vial of IV methylprednisolone so that in any exacerbation I can administer that. So I am having that precaution. And you also take all those precautions with all those immune-related issues as well as steroid, if you are on steroid or hydroxyquine and those related issues. So again, take care of your hydration and keep close to the doctors.
Thank you. We'll go first to the question related to hepatitis B in the chat box. So one person has asked, is 1 dose of hepatitis B enough? Another has asked that they live in Dubai, they do not have Hep B vaccine as a requirement. They have 2 doses on their vaccine card dated 2006. So is it enough, the 2 doses that are dated 2006? And this other question, is 1 dose enough?
And these are recurring and very important questions. So ideal, let me talk to you about ideal dose. Ideal dose are 3 doses. The first dose taken at this point of time, for example. Second dose will be taken after a month. And the third dose is taken after 5 months. That means 6 months after the 0 dose, the first dose. The first dose now, second dose after a month, and the third dose after 5 months. This is ideal, full protection. But for emergencies and for travel, 1 dose will confer some 40% of immunity. 2 doses, even better. But 3 doses will be 100% immunity. Now, in Tanzania, normal people who are walking around, it is not a requirement for Tanzanians to take hepatitis vaccine. Anybody who is selling kahawa, or is selling food, or is in a shop selling clothes or spare parts, or nobody is required to take hepatitis. It is recommended for doctors to take hepatitis vaccine because they are prone to getting needle pricks and exposure to patients. But it is highly advisable to everybody to get vaccine. It is actually all the children from year 2000 in Tanzania have got minimum 3 doses of hepatitis. Those who are born in Aga Khan or other private hospitals, maybe 4 doses, because they give it at birth as well, which is recommended. So the government gives us hepatitis B vaccine for children. For those who are under 23 years, they don't need to take hepatitis vaccine because they have been vaccinated in their childhood. But those who are above 23 years, you are not vaccinated with hepatitis B in Tanzania because it didn't exist. And therefore you should take this because you don't know what could be the level of exposure when you travel. Accidents, requirement of blood transfusion, kudala, kasta, or any other conditions. Okay.
So for now, they should take 1 dose.
For now, minimum 1 dose will give you a little protection. you can take 2 doses because you are traveling on 16th of June, and now it is 18th. So if you go tomorrow, 16th of June will still be 28 days from the first dose. You are still good to take 1 day before travel. It's fine between 1 or 2 days up and down. That's why I wanted this lecture today, so that we can get at least 2 doses of hepatitis vaccine. So if your vaccine card says 2006, it is good to take 1 dose. The one who is living in Dubai, take 1 dose and it will boost your immunity. It will act as a booster, and you will be more healthier and stronger and more protected, inshallah.
Somebody has asked any advice for pressure patients. Do you avoid them?
So for pressure patients, you need to take plenty of fluids, avoid salty foods, avoid exhaustion, and don't forget to take your pressure medicines.
On July 10th, it will be 10 years of taking yellow fever vaccine. Would this work with the regulations?
The new yellow fever vaccine is lifelong, so there is no problem.
I've taken COVID vaccine more than a year ago. Is that enough, or do I need to take a booster? Single dose of Janssen.
COVID vaccine, single dose Janssen, no problem. 1 dose is essential. So the requirement from Saudi government is any of the vaccines, such as the Janssen or the Moderna or Pfizer. Except for the Pfizer, you need to have both the doses to be effective. So either 2 doses of Pfizer or 1 dose of Janssen or 1 dose of Moderna. If you have taken any one of those, no problem.
If you don't take any Hep B, will the Saudi allow to enter?
Usually they would not restrict you to enter with hepatitis B not taken, but they might keep you on quarantine for 10 days for getting you a vaccine and then getting you into the haram. So it's okay, they will allow you to enter, you'll go to Hajj, but you will stay in the airport for a few days and get the vaccine at their price. So that is another downside, that you will be disrupting the group. And hepatitis B vaccine is good for you if you have not taken it. Please take it. Okay. For the one who is 17 years old, getting a COVID vaccine is a good idea.
So hepatitis
but
B.
The 17-year-old doesn't need to take hepatitis B, because in Tanzania, all the children below 23 years have got 3 doses of those chanjo during the early childhood, the first year.
So Hep B people are still asking, they're saying, one is saying, do all 3 doses have to be from the same company, as I might be taking in a different country?
No problem. They can be from different companies.
And in 2010 or 12, they're not sure. So if they're not sure, if they take a booster, is there any harm?
A booster is no harm. I have taken hepatitis, all the 3 doses. Once I finish 2 or 3 years, I take 1 more dose to boost myself. There's no harm.
Do we have any questions? Maybe anybody wants to ask directly? We don't see any hands up. You can raise your hands and we'll unmute you. You can ask the question directly, verbally. So do volunteers carry over-the-counter drugs like ibuprofen, cough syrups, and do individuals have to carry them themselves?
Most of the drugs carried by the volunteers, you remember the drugs are actually either solicited from donors to get this with us. So the sources are, the availability is very limited. So it's good to carry a couple of your own over-the-counter drugs like Panadol, Brufen, your little cough syrup or nasal spray, whatever you are using normally, just a little small emergency kit. Because sometimes even the volunteers, especially during the travel from Arafat to Muzdalifah, Muzdalifah to Mina, because will be many 170 people, so the doctor may be very far and you are little separated. Maybe the ladies and gents are separate. You need 2 Panadols for a severe headache. So it's good to carry a few little OTC, over-the-counter supply of your own, a little bit.
I think the 17-year-old about the COVID vaccine wants a bit of clarification.
Yeah.
You say yes, they should get it, but they're asking, do they need to have a COVID vaccine certificate to go to Hajj?
I think the Saudi government requires COVID certificate. And you can actually be given this in certain hospitals.
Any precautions for heart patients?
For heart patients,
You mentioned it today.
you need to be careful not to exhaust yourself too much. Have enough time to rest. But if you find any breathlessness or sudden dizziness or lightheadedness or a little chest pain, take it easy and don't hesitate to call anybody near you, to call into the physician to talk to you and look at you and examine you. We do not have a portable ECG, but we know all the nearby hospitals and health centers which take care of cardiac patients. So if we will find any need, for example, you feel dizziness and you have a little more sweating than normal and you feel lightheadedness and little chest pain, we'll tell you to rest, don't panic, take your medications regularly, and we will take you to the nearest center. No panic, no hangama. Go there, get an ECG, take rest, and you will be fine, Kabisa, inshallah.
So I see most of the questions are vaccine related. Somebody asks, they took 2 doses last year, Hep B, do they need to take any this year?
It is good to take this year for you and for the Hajj.
Can we have both Hep B and meningitis together?
You can have 2 or 3 vaccines on the same day together, no problem.
And
so for example, you can take yellow fever here, you can take hepatitis here, and then in the same place, a little down, you can take meningitis as well.
And meningitis also, if they've had in the past, do they have to have it again?
The old meningitis was like every 3 years. The new meningitis I'm talking about 3-4 years ago, the new version is lifelong.
Okay.
So if you had 3-4 years ago, 5 years ago, it's better to take it again.
Very interesting question. Do we need official certificates for the vaccines, or would the doctors not suffice?
The yellow card is good, where you can get it signed and stamped. And if you have really taken it, then you will get an official certificate signed on your paper. It's good not to start with a wrong footing. Take vaccine honestly, because these are very healthy and good things to do for you and the family.
Can pregnant women take COVID vaccine?
Pregnant women should not take COVID vaccine, should not take meningitis vaccine. In fact, they should not take any vaccines.
COVID vaccine taken 2 years ago is fine, or a booster is needed?
It's fine. 1 dose of COVID vaccine at any time since the vaccine started is no problem.
3 doses of Sinovac before, is it necessary to get Janssen vaccine now?
Sinovac is not recognized in Saudi because of various reasons. So good to take 1 dose of Janssen.
So it's Janssen, Moderna, and 2 doses Pfizer.
Pfizer, yeah.
For people prone to heat, strokes, or exhaustion, what are the recommendations, especially when we can't avoid to be under the sun during the 3 primary days?
During the 3 primary days, actually, you can avoid being directly under the sun. There are tents, so sit in the tent and do amal. If you are not in ihram, for example, then you can cover your head. Use a scarf and the dishdasha, or just scarf or kufiya. If you are not in ihram, in normal clothes, you can wear a cap. Make sure you wear a hat. For those primary days, best to drink a lot of water and sit around the shade. Traveling in shade is not allowed, traveling in shade. But sitting in the shade is allowed, actually. It's recommended for health reasons.
Any advice for migraine patients?
Take your medicines together, avoid a lot of noise, avoid cheese, avoid too much salt, and make sure your blood pressure is well controlled. The migraine patients. Okay. No hands?
No hands up. No more comments either. We've had a lot of vaccine-related questions. If anybody has any questions related to the during Hajj part, or any other questions, otherwise you may be concerned about pre-Hajj or during Hajj, medical questions.
Mustaba, you don't have any question? I can see you there.
We are 60. So there's a question, we are 60 years above and we are told yellow fever vaccine is not recommended.
Yeah, for those who are above 60 years, yellow fever vaccine is not recommended.
Advice for somebody who had lumbar spine surgery last year.
There are a number of these questions which I think you are asking as if you are pointing a finger to me. I have a lumbar surgery and I'm above 60. So you know what? I think I'm answering my own questions. No problem if you have a lumbar spine surgery a year ago. If you are mobile and able to walk, even short distances, you are good enough to do tawaf. Just don't exhaust yourself. If you are doing tawaf, do it gently, nicely, slowly, aramti. After the tawaf, you can do your 2 rakat salah, have plenty of zamzam water, relax 20 minutes, 40 minutes, then go for Safa Marwa. You do your sa'i 3 rounds, 4 rounds, wait for 10 minutes, rest, then finish the other 3 rounds, no problem. We will wait if you are in our group. The volunteer will wait for you as long as it takes, and they will not push you to have any kutonesha, your lumbar spine surgery. So don't worry, please.
So there was one question we missed. I think somebody asked, so where is the best place to take Hep B vaccine in Dar es Salaam?
Hepatitis B vaccine should be taken in any vaccine center which is reliable and acceptable. And there are a number of them. You can take anywhere. Provided you have an official stamp done there, no problem.
Any advice about low pressure and anxiety patients?
We are going to be the guest of Allah. What else is an anxiety reliever than going and visit the most beloved of all? You are going to meet the Prophet, and you are going to meet Bi Fatima, and you are going to meet other 4 Imams, and you are going to the house of Allah. Just have total reliance on that. There should be no problem. If there are any anxiety, you need to know if you are on any medicines. Don't forget to take those medicines, anxiety related, and read Quran. It gives a lot of sukoon. Sit in the haram for hours. Just sit, watch the gumbat of the Prophet's Rosa. Just look at the Janatul Baqi. Just look at the Kaaba. All your anxiety will disappear.
Is it okay to perform Hajj while being pregnant?
While being pregnant, it's not a problem. Just like any other person, you can do Hajj. The advice is you don't have to exhaust yourself, and you know your primary responsibility is your child, and therefore don't do anything which may cause any risk. For example, exhausting yourself, going for tawaf in the morning and then whole night until late, walking around shopping and things and exhausting yourself. You might get spotting and other problems, then it's not safe.
So if you're traveling from UK and meeting Mama Jafar's group in Medina, do we still need to take yellow fever vaccine?
For UK, I think the Saudi government doesn't require yellow fever vaccine. The yellow fever vaccine is those from Africa. So those who have lived or are British citizens, they don't need yellow fever vaccine, but hepatitis and meningitis must.
Do we need any kind of health insurance for the Hajj trip? If yes, what companies?
There are two answers there. There are certain companies globally who give health insurances. And I'm not very sure of the names of the companies, but most of them are giving you a package. They give you a package of how many, 21 days, or a package of evacuation from Saudi to your to hometown or country. There are packages like that. So you will need to find out from your travel agent. There are agencies doing it.
Travel insurance.
Travel insurance. When the travel agent who is booking your ticket, they can actually advise you to travel insurance. For Tanzania, there are such things. There are those people who are already insured and have international insurance like Bupa and others. You can use that one, yeah. But I will have another answer. Having immense faith and reliance to Allah and doing what is to your best of your ability to keep healthy and to do sadaqatul jariyah before you leave, that's the best insurance you have.
The first dose of hepatitis gave me severe weakness with joint pain, fever and back pain. Will the second dose do the same? I think they're concerned about taking it on the day of travel.
If you are concerned about taking it on the day of travel and you have taken one dose, fine. Little protection is better than no protection. And the second dose will also cause you same symptoms. They call reactive symptoms to the vaccine, and it happens to many vaccines.
Any supplements recommended to take prior or on the trip?
Many people recommend vitamin C and just a lot of vitamin C and some multivitamins for elderly people. Vitamin C is a good thing. It's a good immune modulator. Vitamin C can be 60 milligrams can be achieved from one orange. So if you take 2 oranges every day from Mama Jafar's group, it's fine.
So we have one clarification.
Yes.
From the group. It is our visa covers medical insurance while in Saudi.
Yes, from last 1 or 2 years, the visa covers a medical insurance. What it means is if you become sick, you are treated free in any of the government hospital in Makkah and Medina during Hajj. So I have taken a number of patients to the hospital during Hajj. Don't panic. It was a natural process of whoever was ill. And when we took them, they asked for a badge and a copy of the passport. You have to have a copy of your passport and the badge, the ID. And they say, oh, this is Hujjaj. So whatever treatment you are getting there is free, even to the extent of a stent or plasmapheresis or dialysis or anything. All of it is covered by the government. That's why we have to pay the insurance, so that it covers their medical cost.
So our visa does cover that.
Yeah.
I think just mention again the COVID vaccines that you said, because somebody has asked about 2 doses of Sinopharm.
Yeah, the Sinopharm is not accepted in Saudi. It's not acceptable. So just take one.
Janssen or
2 doses of Pfizer.
Can yellow fever vaccine be taken if one is SLE?
For SLE, if you are on steroids, don't take yellow fever vaccine. If you are on steroids, don't take yellow fever vaccine. Because it's a live vaccine and steroids can be harmful for it. Okay.
Do we have any more questions in the chat or live? Just hydroxychloroquine, not on steroids.
Then it's fine to take the vaccine.
I think COVID is a common question. So if you have taken 1 shot of Janssen
Moderna.
If you have taken 1 shot of Moderna or if you have received 2 shots of Pfizer, that is sufficient.
Anytime during the vaccine era. So during the first year of COVID, there was no vaccine. The vaccine developed after 1 and few months. If you have taken 1 dose, it's fine.
Janssen is Johnson & Johnson, J&J.
J&J. Sputnik is fine.
So they're asking if taking steroids, is it okay to take hepatitis vaccine and meningitis vaccine?
If taking steroids, it's fine to take hepatitis and meningitis. But not the yellow fever.
So Sputnik also doesn't apply, right?
Sputnik,
no. Yeah, no Sputnik, no Sinopharm. Janssen, Pfizer 2 shots or Moderna? Do we have any more questions from the live stream? We don't see any hands up. Okay, I think we've got some appreciation. Thank you for the presentation and some of the answers. Thank you. It's 9:25. Last question, maybe. How soon prior should we take meningitis?
A minimum of 10 days.
Prior to
travel.
Meningitis. Okay. With that, thank you everyone for joining, and congratulations on receiving this call to join to join on this holy pilgrimage, and inshallah remember all of us in du'as. And if you have any further questions that do come up prior to the travel, of course during the travel, and otherwise, then yes, you can always contact Prof. If
for ladies issues.
In case there is any sensitive questions, or if the ladies have any particular questions that they want answered while they would rather remain anonymous or something along those lines, they can always forward them to Zainab Bhai Walji, and Zainab Bhai will get them answered and then forward the answer to you.
I will be also attending the masails in person. So if people want to one-to-one meet me in person,
sure,
and ask questions, then we can meet during the masail.
Sure, yeah. So he'll also be around during the masails in case you have any further questions. And I think Zainab Bhai, maybe we have somebody in the messages, so maybe you can send them your number. Somebody has requested it. You can send them on a direct message, please. Otherwise, thank you all for joining. It's been an hour, and inshallah, we wish you all, okay, here Zainab Bhai has shared the number. We wish you all a very fruitful and blessed journey, and inshallah, in good health. May you go and may you come back. Asante sana, Prof, for joining us today and for sharing with us your knowledge.
I can see young people like Dr. Uruj there, and I would want him to be my right hand, so I can teach him and leave a legacy around.
Inshallah. Okay, with that, thank you. We'll now end the call. Jazakallah.
Hafiz.